Assessment data analysis. Health history. The patient presents with high blood pressure. He complains that his current medication does not improve his condition. He wants a new medicine. He has no other health concerns. Client's strengths. The client is aware of the importance of healthy living. He exercises every day in the morning and has 2-hour walks every day. He is aware of his blood pressure problem and he strives to manage it, and therefore, he came to seek help without any other complaints. According to Buttaro et al., a patient cognizant of his key health issues and the importance of lifestyle alternation to promote health will have better health outcomes. Based on this theoretic information, a conclusion can be made that the client can be evaluated as willing to cooperate with the healthcare provider and having a good prognosis. Areas of concern. The patient has elevated blood pressure despite being compliant with the prescribed medication regimen. He has a family history of hypertension and stomach cancer, which is of concern with regard to his current condition. The client smokes 2 times a month. Health teaching topics. Health education needs. The patient needs education on the risk factors of hypertension. He needs to understand which risk factors are modifiable so that he can actively partake in his health promotion and disease prevention. The patient needs to be educated about smoking-related health issues. Even though he might think that smoking occasionally is not a problem, he needs the scientific data provision to learn that such an attitude is dangerous. Nursing plan of care. Diagnosis. The hypertension problem is the major health issue for this patient currently. Hypertension in its turn is the risk factor for multiple other more complex health conditions. First of all, these are cardiovascular conditions such as myocardial infarction, CAD, PAD, and stroke. Next, high blood pressure is associated with aneurysm, kidney problems, brain damage, and dementia, to name just the central risks. Plan. The care plan goal for this client is to offer medications for his problem and involve him in the treatment process by helping him quit smoking, evaluate his nutrition regime, and make updates if necessary. The expected outcome for the patient is the blood pressure rate decreased to the baseline. Cultural considerations for this client are based on the fact that he is an American of European origin, respecting Western values of quality life. He wants to stay healthy as long as possible to be able to see his grandchildren and live a quality life with the family he loves so much. Therefore, a conclusion can be made that the client has an excellent support system and his cultural background contributes to the success of treatment. Intervention. I will prescribe to Norman 50 mg a day for blood pressure modification. I will recommend urgent smoking cessation and will offer practical suggestions to join the local community support group and obtain free nicotine replacement if needed. I will refer the patient to the local nutritionist to evaluate his dieting regime and whether it is not a contributing factor to his problem. Evaluation. To carry out the evaluation, I will trace the patient's blood pressure rate improvement, his overall health condition, and his involvement in his further health promotion activities. Study Corgi can help you make your studies smarter. Visit studycorgi.com for more samples like this, study tips, and writing tools.